Mr. President, thank you. Mr. President, as we approach the end of this Congress, I rise today to discuss not only what we've accomplished in this chamber, but also specifically what we have accomplished for the state of Nevada. I'm especially proud of that many of my priorities have been able to move forward to help Nevadans thrive, from veterans to health care to infrastructure. These accomplishments prove that this majority was prepared to work and produce lasting results. And I look forward to advancing even more priorities that benefit Nevada in the 115th Congress. As a member of the Senate Veterans Affairs Committee, I've been proud to advocate on behalf of Nevada's brave heroes. My focus has always been on issues impacting Nevada veterans most. I'll give you some examples. Guaranteeing our veterans have access to care, ensuring that they receive care quickly, working to hire more VA doctors, providing health care for rural veterans, and addressing that disability claims backlog that we have been working on for years. And in this Congress, there's been a lot of progress. As the co-chair of the Senate VA Backlog Working Group, I've been holding the VA's feet to the fire on the disabilities claims backlog. The VA has adopted many of the working group's policy recommendations, and this pressure has helped reduce the backlogs from 405,000 claims in 2014 to 92,000 today. Although clearly there's much room for improvement, Nevada's veterans are far better off submitting a claim to our Reno or to our Nevada VA regional office today than they were 2 years ago. Nevada was once the worst in the nation, and now it is in the top 25% for performance. Another issue plaguing veterans in Nevada and nationwide is VA doctor shortages. It's hard for VA to recruit and retain medical professionals, and that impacts how quickly our veterans can get their care. I've asked the Government Accountability Office to examine the VA's current policies for recruitment and retention and report back to me on what improvements can be made. And I look forward to receiving that report next year and in acting to ensure we address this issue that affects urban areas like Las Vegas and our rural veterans in Elko, Ely, and Winnemucca. And when it comes to bringing high-quality care to Nevada, I'm also proud that the VA finally opened a brand new VA clinic in Pahrump. And while there have been many positive steps forward for Nevada's veteran community, clearly there's more to accomplish in the next Congress. In fact, I'm working to pass legislation through the Senate right now that would bring greater accountability to the VA by reporting each year on bonuses awarded to critical positions like VA hospital directors. We still have a 20% disability claims backlog and a growing appeals backlog. The VA Choice Program must be revisited in 2017 for reauthorization and improvements. The VA still struggles to fire employees who are poorly performing. Rural veterans still struggle to find doctors to serve in their area. These are priorities for Nevada veterans that I'm committed to advancing every day that I'm here in the United States Senate. I'm also particularly proud of the work we've done here in the 114th Congress on infrastructure. Those efforts yielded major results for the state of Nevada. Last year, we enacted the first long-term highway bill in nearly a decade called the Fixing American Surface Transportation Act, or better known as the FAST Act. This 5-year bill provides states with resources and the tools to advance high-priority projects, such as the new Interstate 11 connecting Phoenix to Las Vegas, also the Carson City Freeway, and the widening of the Las Vegas Business Freeway, Interstate 15 in Las Vegas. The bill also included my top infrastructure priorities, the expansion of Interstate 11 to northern Nevada. I've been working for years to improve mobility from Las Vegas to Reno. Surface transportation projects like these spur economic development opportunities. It reduces congestion and increases safety, the recipe for creating short-term jobs and long-term economic growth. In July, the FAA Extension Safety and Securities Act was enacted into law. This important legislation implemented important reforms that make U.S. air travel safer, more efficient, essential to tourism destinations like Las Vegas, Reno, and Lake Tahoe. And again tonight we will debate yet another important infrastructure bill, the Water Infrastructure Improvement for the Nation Act. Included in this package is a bill I sponsored, have been working on with my Nevada and California colleagues for nearly a decade, the Lake Tahoe Restoration Act. This initiative will reduce wildfire threats, jumpstart transportation and infrastructure projects, combat invasive species at Lake Tahoe, and ensuring the jewel of the Sierras is preserved for generations to come. It also includes a provision I crafted with Senator Heinrich that improves the water security of rural Western communities. I hope my colleagues will agree to quickly take up and pass this critical, important legislation for my state, sending it to the President's desk before the end of the year. With a new majority in the Senate, we were also able to make good on a number of promises to the American people on the health care front. First and foremost was being able to send an Obamacare repeal bill to the President's desk within the first year of our new majority. One of my top priorities in our Obamacare repeal efforts was to repeal the 40% excise tax on employee health benefits. In Nevada, 1.3 million workers who have employer-sponsored health insurance plan will be hit by the Cadillac tax. I knew the devastating impact this tax would have on Nevadans, but I also knew that in order to get anything done, we needed a bipartisan effort. My friend Senator Heinrich from New Mexico and I teamed up to successfully include a delay of the Cadillac tax in the omnibus bill at the end of last year. Rest assured, I will continue to fight for a full repeal in the next Congress. This week, we were able to pass the 21st Century Cures Act, which has a 2-year process to work in a bipartisan way to advance medical research and clear out government red tape at the Food and Drug Administration. I was very pleased that 2 of my bills that focus on mental health and protecting seniors' Medicare benefits were included in this health care package. First, my bill, Bring Postpartum Depression Out of the Shadows Act, was included in the mental health title of the bill. After working with mental health care providers in my home state, I learned that Nevadans lack access to the appropriate treatment, screenings, and community support needed to provide effective care for new mothers struggling with postpartum depression. I worked with Senator Gillibrand and helped Committee Chairman Alexander on this important piece of legislation, which builds upon existing state and local efforts by providing targeted federal grants to assist states in developing programs to better screen and treat maternal depression. Another bill we were able to pass as part of the Cures Act was my legislation, the Medicare Advantage Coverage Transparency Act. This legislation requires more transparency of the Medicare Advantage and prescription drug benefits enjoyed by seniors throughout the state. It will also ensure that these benefits continue to provide meaningful coverage to seniors and will help us protect important health care benefits for current and future retirees. More than 30% of Nevada's seniors enjoy their Medicare Advantage benefits, and enrollment continues to grow in my state. Successfully passing a number of health care bills will surely set the tone early next year when a united Republican government finally repeals Obamacare. I'm optimistic that with a willing partner in the White House, we can build on these successes. And I plan on using my role on the Senate Finance Committee, Senate Commerce, Science, and Transportation Committee, and the Senate Veterans Affairs Committee to tackle the challenges facing Nevadans across the state. I know that we will do everything in our power to protect our constituents' access to care as we transition out of Obamacare and into a new era of a 21st century care system that works for patients. I know we'll honor our veterans by improving the quality of care and benefits that they have earned, and we will invest in roads, bridges, clean water, a modern and reliable electricity grid, telecommunications, and other pressing domestic infrastructure needs. And I look forward to working with my colleagues in the United States Senate on these important priorities in the coming year. Thank you, Mr. President. I yield the floor.